Have you ever pondered about the significance of contraceptives in our lives? In the grand tapestry of human health and well-being, contraceptives play a crucial yet often overlooked role. They are not just tools for preventing unwanted pregnancies, but also powerful shields against sexually transmitted diseases. Imagine the world without contraceptives. We would be living in an era where every sexual encounter could potentially lead to an unplanned pregnancy, where the fear of sexually transmitted diseases would be a constant shadow. But thanks to the advent of contraceptives, we have the ability to control our reproductive health and make informed decisions about our bodies. Contraceptives empower individuals, especially women, by giving them the ability to decide when and if they want to have children. This freedom is not just about personal choice, but also about socioeconomic conditions. With contraceptives, families can plan their size, ensuring that they have the resources to provide for their children. This in turn has a ripple effect on communities and nations, helping to control population growth and improve living conditions. Moreover, contraceptives play a crucial role in preventing the spread of sexually transmitted diseases. Condoms in particular are a simple and effective barrier method that protects against a range of diseases, including HIV and HPV, which can lead to serious health complications and even death. In this regard, contraceptives are not just about preventing pregnancies, but also about promoting overall health and well-being. They are an essential part of sexual health education, encouraging responsible sexual behavior and reducing the risk of disease transmission. So as we delve deeper into the world of contraceptives in the following scenes, keep in mind their profound impact on our lives. They are much more than simple devices or medications. They are tools of empowerment, protection, and responsible living. Understanding contraceptives and their uses forms the basis of reproductive health and responsible sexual behavior. Do you know there are numerous types of contraceptives available today? Let's delve into some of the most common ones, shall we? First on our list are barrier methods. These contraceptives work by physically preventing the sperm from reaching the egg. Examples include condoms, which are widely available and also protect against sexually transmitted infections, and diaphragms, a shallow silicone cup inserted into the vagina before sex. Next, we have hormonal methods. These types of contraceptives use hormones to regulate or stop ovulation, preventing pregnancy. Examples include birth control pills that need to be taken daily, and the contraceptive patch that you wear on your skin. There's also the contraceptive injection, which releases hormones slowly over a period of 3 months. Moving on, we come to intrauterine devices, or IUDs. These are small T-shaped devices that are inserted into the uterus. They can be hormonal, releasing a small amount of progestin each day to prevent ovulation, or copper, which is toxic to sperm. IUDs are highly effective and can stay in place for several years. Emergency contraceptives are up next. These are used after unprotected sex to prevent pregnancy. They include morning after pills that can be taken up to 5 days after sex, and copper IUDs, which if inserted within 5 days can prevent pregnancy. Lastly, we have sterilization. This is a permanent method of contraception that involves a surgical procedure. For women, it's called a tubal ligation, where the fallopian tubes are closed off. For men, it's a vasectomy, where the tubes that carry sperm are cut or blocked. Each method has its pros and cons, its effectiveness varies, and what works best for you depends on your health, lifestyle, and personal preferences. It's important to talk to a healthcare provider to find the best contraceptive method for you. The diversity of contraceptives available today means there's something suitable for everyone. So, whether you're planning for a family or not, remember, it's your body, your choice, and there are plenty of options out there to help you take control of your reproductive health. Ever wondered if there are natural alternatives to artificial contraceptives? Well, if you have, you're in for a treat. Our focus in this segment is on natural contraceptives and methods, their application, and effectiveness. Let's start with fertility awareness methods, often referred to as FAMs. FAMs are based on understanding and recording the fertile and infertile phases of the menstrual cycle. This includes tracking basal body temperature, monitoring cervical mucus, and charting menstrual cycles. It's a method that requires dedication, but can be quite effective when done correctly. Next up, we have the withdrawal method, or as it's more commonly known, pulling out. It involves withdrawing the penis from the vagina before ejaculation. This method relies heavily on self-control and timing, and while it's not as effective as other methods, it's certainly a natural option. Another natural method is lactational amenorrhea, a fancy term for the natural infertility that occurs when a woman is breastfeeding. During this time, the body naturally suppresses ovulation, offering a period of natural contraception. It's important to note, however, that this method only works as a contraceptive in the first 6 months postpartum and if the mother is exclusively breastfeeding. While these methods are natural, it's critical to remember they aren't foolproof. Their effectiveness can vary widely depending on how accurately and consistently they're used. For instance, FAMs have a failure rate of about 25% when not used correctly. The withdrawal method, on the other hand, has a failure rate of about 22%. The key takeaway here is that natural methods of contraception can be a viable alternative for those who prefer non-hormonal or non-invasive methods. However, they require a high level of commitment, understanding, and consistency to be effective. In the end, it's about finding what works best for you and your body. Whether you choose a natural or artificial method, the goal is the same: safe and effective contraception. Natural contraceptives provide an alternative for those who prefer non-hormonal or non-invasive methods. What is the relationship between contraceptives and abortion? In a world where the understanding of reproductive health is crucial, it's important to address the correlation between contraceptives and abortion. Often misunderstood, the connection between these two concepts is not about causation, but rather prevention. Contraceptives in their various forms are designed to prevent unwanted pregnancies. When used correctly, they can be highly effective. From barrier methods like condoms and diaphragms, hormonal options like the pill and IUDs, to natural methods such as fertility awareness, there's a wide range of contraceptive choices available. This diversity is important in empowering individuals to choose what suits their lifestyle, health, and personal beliefs best. Now, where does abortion fit into this picture? Abortion is a procedure carried out to terminate a pregnancy. It's often a difficult and emotional decision made due to various reasons, one of which can be an unwanted pregnancy. Here's where the role of contraceptives becomes significant. By effectively preventing unwanted pregnancies, contraceptives reduce the need for abortions. It's as simple as that. The more people who have access to and use reliable contraception, the fewer unwanted pregnancies there will be, and consequently fewer abortions. This relationship is supported by numerous studies worldwide. There are some myths out there suggesting that contraceptives themselves cause abortions. This is a misunderstanding. Contraceptives work to prevent the fertilization of an egg or implantation of a fertilized egg in the uterus. They do not terminate an existing pregnancy, which is what an abortion is. So why does this matter? Understanding the relationship between contraceptives and abortion is vital in promoting reproductive health and empowering individuals to make informed decisions about their bodies. It also highlights the importance of access to and education about reliable contraceptives. In conclusion, contraceptives play a significant role in preventing unwanted pregnancies and, by extension, reducing the need for abortions. They do not cause abortions, contrary to some misconceptions. Contraceptives play a crucial role in reducing the incidence of abortions. What are the key takeaways about contraceptives and their importance? This question brings us to the closing chapter of our discussion. Contraceptives are not just about avoiding an unexpected pregnancy, they are an essential part of reproductive health, empowering individuals and couples to make informed decisions about when and whether to have children. In our journey through this topic, we've explored a wide variety of contraceptive methods, from hormonal options like birth control pills and patches to barrier methods such as condoms and diaphragms. Each method serves a unique purpose and caters to the diverse needs of individuals. Beyond these, we've also discussed natural contraceptive methods. While these may not be as effective as their medical counterparts, they offer an alternative for those who prefer a non-invasive approach. Methods like fertility awareness and the rhythm method require a deep understanding of one's own body, offering a sense of empowerment and control. The diversity of options available is a testament to the progress in reproductive health. However, it's important to remember that no method is 100% effective. Each has its own set of advantages and disadvantages to consider, and finding the right fit may take time and consultation with a healthcare professional. Contraceptives also play a critical role in reducing the need for abortions. By preventing unwanted pregnancies, they reduce the physical, emotional, and financial burdens associated with abortions. The use of contraceptives is a proactive step towards maintaining reproductive health, and their importance cannot be overstated. In conclusion, contraceptives are a key tool in ensuring control over one's reproductive health. They offer a range of options to suit different needs, lifestyles, and preferences. Informed and responsible use of contraceptives can help avoid unplanned pregnancies and reduce the need for abortions, contributing to better overall sexual and reproductive health. Remember, understanding and using contraceptives responsibly is essential for your sexual and reproductive health.